Let's talk about metformin. Very, very important. We need to see how this medication works for you and how this medication works for everybody else. In my opinion, metformin is the best oral medication for type 2 diabetic patients. Remember, it is very important. This medication has been around for years upon years. It works in your root problem. That is the insulin resistance. Unlike insulin, metformin does not force your pancreas to work harder. Now, metformin helps your body use insulin better, and it also produces less unnecessary glucose. Now we need to see the real major pathophysiology behind this medication. Remember, metformin works in three major places. Number one is your liver. Now, when you go to sleep at night, your liver normally releases glucose. So in patients who have type 2 diabetes, their liver releases too much glucose. And that's when metformin comes in. It suppresses something called the hepatic gluconeogenesis. That is when the metformin is telling your liver that stop throwing too much glucose into this person's bloodstream. And number two, metformin works in your muscle and fat cells. Remember, metformin improves insulin sensitivity. It also helps glucose move from your bloodstream into your cells more efficiently. You need to understand this medication. Now, you need to understand this medication comes in and it breaks all insulin resistance doors. It definitely does the job. Number three, it works in your gut. It is very important. It reduces glucose absorption from your intestines after you are done eating. Now, a lot of people don't even know this medication alters something called gut microbiota. This definitely contributes to improved glucose control. We need to understand how this medication really is. Now, who can take metformin? Then you need to understand people who have type 2 diabetes, they can take this medication. Patients who have pre-diabetes, polycystic ovarian syndrome, that is the PCOS. Now, patients with insulin resistance, metabolic syndrome, these patients can take this medication. And also, this medication is great for people who are overweight. That is those who are obese. They can take this medication. Now, those who have high cardiovascular risk factors can take this medication too. Now, let's say a patient who wants to take a medication without gaining weight, metformin is also great for them. It is proven. Now, I want you to be very careful when you're using this medication. Number one, if you have severe kidney disease, when your eGFR is less than 30, please consult your doctor. Number two, when you have severe liver disease, unstable heart failure, when you are septic, when you are dehydrated, when you have something called hypoxia, please make sure you inform your doctor first before you take this medication.